Welcome to Advancing Health. South Dakota-based Sanford Health is America's largest rural healthcare system. But even with its hundreds of locations, some patients still face voyages of hundreds of miles to access the care they need. In today's podcast, recorded at one of the world's largest digital health conferences, we hear how Sanford is innovating with both telehealth and artificial intelligence, AI, to shrink those vast distances and deliver quality medical care to all who need it, regardless of where they are.
Hi again, everyone. This is Dr. Chris DiRienzo. I'm AHA's Chief Physician Executive, and I am super excited to be here on the sidelines of one of the world's largest digital health conferences with Dr. Dave Newman. Dave and I have known each other for a while now. He is an endocrinologist up at Sanford Health in the Dakotas, and he is the Chief Medical Officer of Virtual Care for a health system that knows a little bit something about how to serve rural and frontier populations. And you can hear it in the background. We are on the sidelines of this large conference, and both of us happen to be talking innovation. We got you to agree to jump on the podcast with us and talk a little bit more about it.
Yeah, thanks for having me. I appreciate it.
So for you all, innovation is really grounded in your need to serve your population. So remind our listeners a little bit about Sanford Health and the populations you serve and why innovation has been so core to what you do from the beginning.
Yeah, so at Sanford Health, we're the nation's largest rural healthcare system. We range all the way from Wyoming to Michigan. We have lots of hospitals. We have got big hospitals, we've got small hospitals, we've got critical access hospitals, we've got clinics, we've got a health network, we've got a nursing home. One thing that we don't have, though, is a problem that a lot of rural America has, is enough providers. We realize that we have to jump to innovative care models to survive because our patients really need it.
Well, it's innovative care models, and you need providers, but you also have patients who are spread far and wide. I mean, you all were incredibly generous with your time. We spent some time together in the fall, and you showed me what it really is like in parts of rural North Dakota where your patients live. Talk to us about that, and then we'll return to, given that this is who you all serve, and it really is a sacred mission that you have, the kinds of innovative approaches that you're taking, both with virtual care and with AI.
Yeah. So when I say rural, I mean really rural. So in North Dakota, I live in Fargo, North Dakota. I'm the only andrologist for the state of North Dakota.
Holy crap.
And Fargo is on the eastern part of the state.
Okay.
And a lot of my patients come from western North Dakota or even Montana. It is a 400-mile drive one way to get to see me.
Whoa.
And oftentimes it's for a 15-minute appointment.
Oh my goodness.
And so if they're coming to see me for their hypogonadism or infertility or another thing, I'm the only option in town. You can imagine how frustrating it is if there's a blizzard, or even if there's not a blizzard, for them to have to drive that far, take a day off of work, have multiple tanks of gas, to miss time away from their loved ones to do something that can be easily done virtually.
And that might even be 2 days, because I could imagine, if that's an appointment you've been waiting on, and you described a little bit about what you do, but remind our listeners what an andrologist is in just a moment.
Yeah.
I mean, I would drive 400 miles and spend the night just so I don't miss that, because it can be such a key conversation in a family's life.
Right, absolutely. Yeah, so andrology is sex hormones, so it's a lot of if your testosterone is low or if you're having troubles reproducing.
Yeah, from a health perspective, even having one provider like that in that part of North Dakota is great, but you need to reach a massively spread out population. So obviously you're the CMO of virtual care. Let's talk a little bit about how Sanford and you think about the kinds of virtual care options that allow a provider with your experience to reach people who are hundreds, if not 1,000 miles away.
Yeah, so we've really been listening to patients and what they want. So one of the big things we heard is that they don't want to be transferred to our flagship hospitals. So we've got lots of smaller hospitals that feed the larger hospitals. One of the big issues is the lack of some of the pediatric subspecialties in the smaller hospitals. So for example, pediatric infectious disease. If a patient needs a pediatric infectious disease consult, they often had to be transferred to Fargo or Sioux Falls for the higher level of care.
Wow.
You can think about as a parent, if your child is transferred, you're missing work. You have other children that you can't attend to. It's a big burden. So now leveraging technology and leveraging virtual care, we can beam our own providers, our own pediatric infectious disease doctors into their hospitals. We can keep the patient there. Sometimes you can just see how relieved the patients are knowing that they're not going to have to be transferred and knowing that they still get the same high quality specialty care in their hometown hospital.
Let's talk a little bit about follow-up, because it's not just in-hospital care. And we got to visit Dickinson, North Dakota. And one reason that you all took me there is it made national news. The virtual care setup that you had in Dickinson was such that patients who had, pediatric patients actually, who had chronic conditions that were requiring them to drive 1,100 miles round trip to see subspecialists, you could now set them up in that building. So now maybe it's an hour's drive from the ranch that they live to Dickinson rather than 7 hours each way. That doesn't happen accidentally, right? You have to be very intentional about designing a system to work like that. How do you do it?
Yeah, so a lot of it is what the patient wants and from provider buy-in. So we've had some champions that have driven this, and we have failed fast on a lot of these models that didn't work. For our hub and spoke model, a patient, it's the easy button for the patient. So if they're not tech savvy, they can go to the clinic. They can have a nurse room them in a regular exam room, and then the provider beams into the room. So it's just like a normal visit. One of the great things about that is they're already there for labs. So if a patient needs an x-ray, they're there.
Yeah.
If they need blood tests, they're there. And it is their trusted provider. Those labs are going to go straight to their in-basket, and they're going to have follow-up there. So it's defragmentizing care.
I love this example because medicine is always a spectrum, right? I'm a neonatologist, you're an endocrinologist. I see babies at the super, critical hyperacute end of the spectrum and out in follow-up care. And telemedicine is no different, right? There are telemedicine visits you can do in a patient's home with the technology that just exists on their phone. But these kinds of visits that we're describing here, you need really special setup so that, for example, a pediatric pulmonologist can know what they need to know about, a child who has a chronic condition, to say, no, you're good. You don't have to make the 1,000-mile round trip drive this month. That's sort of one part, though, of innovation. We're both here at this conference, and innovation takes lots of forms. I know you all are early users of any number of AI-enabled solutions. But where are you seeing an impact today, either for your physicians and APPs or for patients?
Yeah, so one of the best use cases of AI that I've seen in my career has been artificial intelligence for diabetes. In my previous career, I treated a lot of type 1 diabetes, and patients had an insulin pump, which you can imagine is like a cell phone that they wear in their belt, that talks to a sensor, which is a sticker on your skin that continuously checks your blood glucose. There is an artificial intelligence algorithm that tells you when you need more insulin and when you need less insulin, and it will do it for you.
Wow.
It's the easy button. So that was really cool technology that came out several years ago, but the software was clunky. So they had to come to a major diabetes center to have it downloaded.
Okay.
With our feedback, a lot of the companies have been able to bring this into the patient's home. So there's an app or a program on their home computer that they can use, and we can do all of their work virtually. So for a condition like type 1 diabetes, that is like a part-time job, that it is 4 hours a day, we have completely revolutionized it. So sometimes I see a patient once a year for their type 1 diabetes. And
once a year?
Yeah, so it's partnering with the technology. We firmly believe that artificial intelligence is going to be a tool that we use. It's not going to replace doctors, but it's going to absolutely kind of the stethoscope of 2025.
I mean, for those who are listening to the podcast, remember that's the type of diabetes that you typically are diagnosed with when you're young, and for generations that meant throughout childhood and your adolescent years, your blood sugars were way off, and so that changed the trajectory of sort of the health band that you could live in for the rest of your life. And Dave, getting to press this easy button for patients with type 1 diabetes who are much younger, I mean, help me understand, you're talking about generational shifts in health outcomes.
Absolutely. So these patients are now not dying from their diabetes. It has given them their life back, that they're no longer on the road for appointments, that they're able to go on cruises, they're able to go on family trips, they're able to do those things, and they're able to be normal kids and normal adults. You use the term easy button. So we are fully committed to not just our patients, but our providers, leveraging technology to make things easier.
Yeah.
That if the solution is to add something more to our patients or my providers, I'm not interested in it. I'm interested in taking things away. I'm interested in making life simple.
And it doesn't have to be in cities with 8 million people. You're making life simpler for patients who get to stay where they want to live with their families for more of the time. Now, I don't think we think about this burden enough in healthcare, that we have patients who it's days, it's weeks, it's months of their life, to be able to access our services. And we are experts in lots of different things. You're almost turning that around by being able to project care into people's homes using technology. But let's talk about the providers for a minute, because I've been there right with you as a CMO of a health system before joining AHA. You don't want every new innovation to workflow to be an addition. And AI, frankly, is one of the technological revolutions I'm seeing that actually is beginning to deliver a little bit on what you said, which is we can actually take some things away that have been layered on. You got any examples of those?
Oh, yeah. So the best example is one that's really hot right now is ambient listening.
Yeah.
So we rolled this out recently, and I cannot believe how well it works. So for the listeners, this is an AI program that the provider, during your clinic visit with them, will turn on their phone and it'll listen to you and it will write their note for them. One of my buddies is a pediatric oncologist. Really good guy. He was really bad at writing his notes. So he was always on the naughty list is what he called it. So he was getting messages from the CMO saying you need to close your charts. And he did this for 12 years. We opened ambient listening to him and he texted me the other day and he said, Dave, I didn't miss my daughter's recital. I'm not on the naughty list. Like this is giving me my life back.
A little bit depressing, frankly, that baseline. It's just an expectation that, yeah, I'm going to miss the recital, right? Like that's what you and I, it's the culture that we've grown up. It doesn't have to be that way anymore. And I'm hearing the same things. I've now heard from multiple systems in multiple states on multiple different platforms that on average, ambient listening seems to be decreasing in EMR time by double digits, some sort of high double digits.
Absolutely.
And that time is being returned to us to do the things that the human part of healthcare.
Yeah, so it was interesting. I was talking with a patient the other day who was in a clinic visit with one of their providers that was using this, and they had a real conversation. Because now being a provider, it's hard. You're always ordering things on the computer. You're looking at labs. You're trying to type your note as you go, and it's lost the human element. Ambient listening has given that human element a chance.
I mean, we shifted to electronic technologies for all of the right reasons. You know, it has certainly led to some positive outcomes for sure, but you're exactly right. Healthcare is, and always has been and always will be, a uniquely human experience. And we need to keep threading that thread of humanity through the needle technology if we're going to be able to experience the stuff that brings us joy as doctors, right? Getting to spend time with our patients, getting home and getting to our kids' recitals. You know, as long as we've got folks like you, Dave, out there leading the innovation, I tell you what, I am incredibly optimistic about the current generation of trainees walking into a practice of medicine and of nursing, respiratory therapy, and lab techs, and all of the professions that is only going to keep getting better. Thank you so much for joining us on the podcast. It's been a total privilege.
Thank you, Chris.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.